And welcome back to Talk of Alabama. Joining me now is Dr. Emily Bell Casey from Andrews Sports Medicine and Orthopedic Center. And today we are chatting about the most common running injuries that can occur even weeks after a long distance event. So first, welcome to you, Doctor.
Thank you. Welcome.
Thank you for being here. You know, do you guys see, we just had the Mercedes, do you guys see an increase in injuries after such events or such marathons?
Yes, we do. So with long distance running and events like a marathon, we will see increase in knee, leg, foot, and ankle injuries. You know, a lot of these athletes will recover after the marathon, maybe have some muscle soreness or blisters, but then there are a few that may have lingering injuries.
Well, you just mentioned a little bit about the foot and about the ankle. Now, are these real common as far as overuse injuries?
Yes, the most common thing we see with long distance running is overuse or chronic injuries, such as things that affect the knee, ankle, and foot.
And speaking of knee pain, I know a lot of people deal with knee pain. Is that something that you guys work and help patients with?
Yes, there's something called Patellofemoral pain syndrome, or runner's knee or jumper's knee. Your quadricep muscle, so the muscle in your leg, helps control the kneecap. And if there's tracking issues, meaning weak muscles, low arches, high arches, things like that, that repetitive overuse motion can irritate the knee, make it not track well. So we do things, physical therapy to strengthen the muscle, bracing to track the kneecap better, inserts in your shoes. We do things like that to help the knee injuries. And then we've got other injuries too.
Now, I'm not a runner at all, but is it good for you? Should more people be running, or is it hard on you? It seems like to me when I see people running, I think, I should go out and do that. And then I think, secondly, no, I don't really want to do that because I'd probably get injured or wear out my knees sooner than they should be. Is it good for us or bad for us to run?
Well, that is probably a complicated answer, but you know, running and exercising is good for you, but of course the constant chronic pounding to certain joints can cause injuries, overuse injuries. So, you know, these athletes, they are training months at a time, several days a week, and putting a lot of mileage on their bodies. So I do think it's important to cross-train, you know, give your body the rest that it needs after a race, you know, swim, bike, and run so that you're not getting some of these injuries. And there are some other injuries in the foot and ankles, such as plantar fasciitis, that causes heel pain, and that's another overuse injury that will feel like a bone bruise, hurt to run, walk. A lot of times we'll look at your arches in your heel and maybe put inserts in your shoes, do physical therapy, recommend stretching. You know, your Achilles tendon in the back of your ankle can also be affected by these chronic running or repetitive motions. If you have a tight calf muscle or a plantar fascia that's been bothering you, that Achilles tendon can also get inflamed, swollen, tender. And so stretching, physical therapy, you know, and relative rest. So those are some of them.
How do you know if you're a runner and you're watching a segment and you've got a little bit of lingering pain? How do you know if it's just something that will just kind of go away on its own or a bigger problem?
So a lot of times after running these type of races or training, you know, again, you may have some muscle aches, cramps, soreness. Most things with some relative rest, a couple of days stretching, again, cross-training, giving your body time to rest, should go away. But if they continue to hurt, then you could be concerned about these. And one thing to look for is stress fractures, and it's exactly what it is. It's a stress injury to the bone. It may actually even cause a crack in the bone. And so you may have pain with running, pain with walking, and then pain all the time. And you need to rest to let those injuries heal.
Okay, doctor, how do people get more information?
So we have 3 locations in the Birmingham area. Our telephone number is 205-939-3699. And we have a website, andrewsportsmedicine.com.
Okay, thank you so much for the insight. And again, listen to your body. We appreciate your time, doctor.
Thank you.
Of course, come back.